Just a little bit further question on the possibility of getting vaccine into long-term care homes and to the residents. Is there any sense about the timing of that at this point? You say a couple of weeks. Can you be more specific? And is it likely there any chance of it being the Pfizer vaccine, or will it more likely have to wait until Moderna, given its sort of imminent approval?
Yes, so that's the question. We are watching very carefully. So Pfizer has required, as I've mentioned earlier, us to administer the vaccine at the point of arrival of the shippers, the shipping containers that have the dry ice and everything, and that we had to have an ultra-low temperature freezer at that site. And this was to proof the system, to make sure that the vaccine could be transported safely and to monitor the effectiveness of the vaccine, the stability of the vaccine through all of the transportation. So we are hopeful. We're here that that it may be as early as tomorrow that we're going to get advice from Pfizer about how it's worked. We have different checks and balances and data that we've been sending back to them all along the way, and it's been worked out together across the country. So tomorrow we hope to hear some news. That would be the earliest, and our plan is, as soon as we are able to, that we will be targeting immunization to long-term care residents and workers in the care home. That's the way we do it for influenza, so that's ways that we're quite used to providing vaccines to residents as well as to workers. So we're hopeful that that might happen as early as next week if things work out, that things worked with the supply chain this week. And the second vaccine, as you say, the Moderna vaccine, again, we've heard finally that we are going to be getting some doses in December, assuming it gets approval from Health Canada for safety and for efficacy, so that it works. And just heard not too long ago that the FDA in the US has approved Moderna vaccine, and I know Health Canada is going through the papers and the data right now, and have been for some time, so we're hoping that we'll hear from that very soon as well. So whichever of those happens first, we'll be looking at targeting those people most at risk and moving into long-term care residents as soon as we can. And, that is going to be a game changer for us. If we get through this period, we can protect residents in long-term care, and we can start allowing people to safely come back into those communities again and be with their loved ones.
Follow-up, Gordon?
I do. I already had some questions about, people would be, maybe not on the immediate priority list, but sort of a little bit down the list, but still in there, like, folks that are over 80, and just, asking the question, once vaccine's available, how do they find out or know, to get the vaccine? Is that something that will be communicated, by, you have to make an appointment? Will they be notified? Would there be clinics set up that they would, something like you'd go through one of the drive-through things where you get tested, Do we have any idea about that yet?
Yes, so we are looking at all of those ideas, and yes, as we've said, we've had a very small amount of vaccine this week, 3,900 doses. We're figuring out how to use it, how to make sure that we use it properly and that it's safe to use and that the clinics know how to run, and we're going to be expanding that across the province. So we only just earlier this week received confirmation of the doses that we'll be receiving next week and the week of the 28th of December. And today, we got notification that we will be receiving doses the first week of January. So that allows us to understand the numbers of people that we can immunize in these weeks. Having said that, right now, the maximum number of doses that Canada expects to receive in the first quarter of 2021, and what we're receiving here in December comes from that allotment. So we are the contract is to receive enough to immunize 3.8 million people across the country, and here in BC that works out to about 380,000 people in BC. So when we do the math of how many people are in long-term care, how many residents, how many people in assisted living, so the other higher risk environments that we're starting with first, the healthcare workers in our acute care system that are key for the COVID response, and in some of the response, like the public health teams that go out to different acute care facilities, some of our more at-risk populations and people over age 80 in the community. We're looking at phasing that in over the next few months between now and March. And yes, we will have a system for making sure that people have equal or equitable access to vaccine. We're still working through those details as we get confirmation of when we might receive more vaccine. So please be patient. We will be working it through. We will make it very clear when we know how much vaccine we have, how it's going to be delivered, where it's going to be delivered to, and people will get a notification of how they can get their vaccine.